Good afternoon, everybody. Thank you for joining us today for a panel discussion among three members of our Manhattan College community about the rollout of the COVID-19 vaccines. My name is Pete McHugh. I'm the Director of Media Relations and Strategic Communications at Manhattan College. I'll be moderating today's discussion with Dr. Carl Franzetti, a board-certified family physician and co-founder of Riverdale Family Practice just down the street from Manhattan College. He's also a physician on staff here at Manhattan. Welcome, Dr. Franzetti.
Thank you, Peter.
We're also happy to have Nate Garcia with us today. Nate's a graduate of Manhattan College, having graduated in 2018 with a degree in biology. Nate currently is a senior associate scientist at Pfizer, where he works in the clinical and diagnostic assay development division, and has been a part of the research team at Pfizer in developing the vaccine that's been distributed across the country during the past 2 months. Nate, thanks for joining us today.
Happy to be here, Pete. Thank you.
We also have Dr. Tekeyah Sears here with us today. Dr. Sears is an assistant professor in Manhattan College's public health program. Dr. Sears has a bachelor degree from Penn State University, a master of public health degree from Penn State's College of Medicine, and a doctorate of education from Columbia University Teachers College. Dr. Sears, thank you for joining us.
Thanks, Peter.
All right, let's get started. Nate, we were just chatting right before we began. You've had a busy day so far, and I'm sure a busy year. Can you talk through your role at Pfizer and what you've been doing over the past year, past 11 months, in terms of the research that's gone into the vaccine?
Absolutely. So first, I guess my role as a senior associate scientist in the clinical and diagnostic assay development department, obviously we're in vaccine research and development, and my role specifically is to support the development of ligand binding immunoassays, in which the data from these antibody quantification assays or experiments are used to show how efficacious our vaccine candidates are. And most recently, as you mentioned, we've been working very, very diligently on the COVID vaccine, where we've had quite a bit of success, as you've seen in the news. And my role for the COVID project, I'm on the team that developed the immunoassay for the project. But more specifically, I played a role in leading the preclinical NHP studies throughput and organizing all of that data. And most recently, I've been helping out with the clinical throughput, as well as making sure every box gets checked for full approval of the vaccine, not just emergency approval. So the last year has been quite exciting, exhausting, but definitely exciting. And when you think about it almost full circle, I've already been vaccinated, actually, so completely full circle. The contributions, I didn't realize how much gravity they would have in terms of global health, but I'm certainly happy to have been able to make an impact, and incredibly thankful to be here. Thank you so much.
And Dr. Sears, Nate mentioned the impact on global health so far. What are public health professionals seeing, during the early part of the vaccine distribution on a public health basis?
So we're seeing a lot of disparities. That's the main thing that we're seeing, disparities between those who are actually getting the vaccine, those who are on the fence or ambivalent to getting the vaccine, or those who may not even want to get the vaccine altogether. So even though Nate's been working on this vaccine for some time, people are still hesitant about this vaccine. So especially within Black and Brown communities. So when it comes to this overall from a public health standpoint, you want to advocate for the vaccine, because overall for public health, we want herd immunity, right? We want over time that this virus is that everyone is in some time build their immune system to build up towards this, so that the disease won't actually spread, in a sense, the disease won't spread further. So that's the whole purpose and the whole goal for that. So in public health, our goal is to advocate. Our goal is to serve in regards to surveillance, to see where the cases are, especially when it comes to epidemiology, where we're seeing the highest number of cases of the COVID-19, and then how can we target those particular areas for the vaccine. So again, as I mentioned before, you're seeing definitely disparities in that, because people are still on the fence about it. People are still thinking, well, is this, an experiment? Is it not an experiment? Are people thinking that what is the vaccine, the detriment, what are the benefits, and probably they have to do a cost benefit analysis to think about, okay, what are the costs and the benefits of actually getting the vaccine as opposed to not getting the vaccine. So I know we're going to talk about a little bit, in terms of the different types of vaccines. So, in regards to the Pfizer, Moderna, and now we have the Johnson & Johnson, probably, as we're speaking, probably going to be rolled out this particular weekend. You see the differences. Okay, Pfizer's, I believe, is like 94% effective, while Moderna is 94 as well. But then I was reading an article that said Johnson & Johnson is probably about 80 something effective, and that's, so that will cause some hesitation. Well, nothing's 100% effective. And I tell my students that all the time in my intro to public health class. Nothing is 100% effective, and we cannot go into things blindly and think that everything is 100% effective when we take a vaccine or take something for our health. So just being educated and aware, but also doing your own particular research. And I'm a big advocate for that in regards to the field of public health.
Thanks, Tekeyah. And you talk about education. Dr. Franzetti, how do you see your role, as a primary care physician in educating patients about the vaccines and about their own health right now?
Dr. Sears, just to paraphrase, so she's 100% correct with the percentages. And that is one of the things that people come in and say, well, it's not 100%, why should I take it? I think the role of a family doctor or any physician is really to educate their patients, to let them know, hey, this is what's out there. This is what we can do. And as much as nothing is 100%, and that's true in anything in medicine, at least the 3 vaccines that were mentioned are 99.9% reduction in death. So one of the areas, especially in New York, where most of our patients have either witnessed or experienced someone passing away from COVID-19, the fact that these vaccines will prevent death to them has been a game changer as far as getting them to accept it. The other thing, again, with Nate, as far as the research, and again, I know there was a tremendous amount this past year, but it really started 30 years ago. So when people hear that SARS virus has been around for that long and that the research started that long ago, they're much more acceptable saying, okay, this wasn't a rushed vaccine. So education really is the key.
Right. And Nate, can you speak a little bit about the clinical trials that that Pfizer had developed, and what exactly went into those trials, and even how you played a role, in those efforts even before it was authorized for emergency approval?
Yeah, and I think my biggest takeaway from watching everything unfold kind of from the inside is that we have a wealth of resources as the industry leader, and we have quite extensive history in vaccine research and development. So we have our Prevnar vaccine that's done quite well globally and has done a tremendous amount of work for public health globally. And we have the polio vaccine that was developed right here on this site that has obviously made an impact. Polio is no longer something that we worry about in our daily lives, right? And so when you think about the resources that we have at our disposal, it's almost an obligation, right, for a company of this size to participate in making sure that we come out of this on the other side as healthy as possible, right? And unfortunately, people take the idea that this vaccine was developed within, the 11 months, and expeditiousness does not mean the same thing as hastiness, right? Again, as I said previously, there is no box that was left unchecked. So when you look at our clinical trials and the way that they were constructed and the size of the clinical trials and our effort to make sure that we had a diverse group of people represented in our clinical trials, as well as people that were immunocompromised, right? These are things that normally have not been done. And the reason we were able to get something at this scale done so quickly is because normally in research and development, you'll try your best candidate, right? Or what you think is going to give you yield the best results. And if it doesn't work out, you go back and you retool a little bit, you fine tune it, and then you go back into clinicals, right? Or preclinicals. in this case, time was really of the essence. So performing experiments or preclinicals and clinicals sequentially was really going to be to our detriment. So instead of doing them sequentially, we really put the resources together in order to do everything concurrently, right? So just as soon as we saw which candidates are going to be good in preclinicals, we quickly moved into clinicals, right? And weeded out the candidates that weren't performing as well. And I think that, you know, people are a little bit nervous about the mRNA platform, as most people are with new technology. But it's important to note that this technology isn't necessarily brand new, and it had been in development for quite some time for the influenza vaccine. The benefit of this new platform is that you can quickly pivot, right? With mRNA, all you need is the sequence, and you put it on the tag for the virus, for the vaccine, and you're good to go. So when the pandemic took hold, we were able to quickly change that sequence from the influenza virus to the spike protein of the coronavirus, right? And so these things were already happening, and thankfully we have the resources and capabilities and global footprint in order to scale up at the rate that was necessary for us to be very impactful in what we were trying to accomplish here.
You know, Nate, you mentioned the influenza vaccine. Dr. Franzetti, yeah, I think when we spoke earlier, you mentioned Riverdale Family Practice has or is going to have doses of the COVID vaccine. What are the differences in terms of how it impacts, you know, your practice in terms of distributing these to patients? You know, the COVID vaccine and vis-a-vis the flu vaccine.
Well, we do have them. We did order about 900, and the CDC sent us 50, but it's a start. And unfortunately, it's not the Pfizer vaccine; it's the Moderna, but it's a vaccine regardless. And one of the best things about it is now we can offer our patients the vaccine that wouldn't have access to computers. Right now, pharmacies and doctors' offices can only administer it to people over 65. The current guidelines is anyone with a medical condition, but they have to go to the state sites. With that said, we have a huge population. We didn't even get to under 75 yet. We're still just doing the people above 75 because they don't have access to the technology to sign up for these vaccines. So it's been very beneficial to be able to offer it to patients. It's really more of a courtesy. It is not something, it's a very time-consuming process because they have to wait, we have to reschedule, we have to constantly remind them to come in so that they don't lose their spot. So from one end, it's work-intensive, but from the satisfaction end, it's great. The patients don't have to go anywhere. They know the office. So it was an easy transition because they knew to come here anyway.
And, you know, access to internet and, you know, technology, that's one of the inequities, one of the inequalities that we've seen in terms of distribution. You know, you hear a lot about, you know, younger people maybe making appointments for their parents, you know, people that might not even have access to the internet, you know, people where English is not their primary language. You know, Dr. Sears, you mentioned, you know, the inequalities, you know, involved in, you know, in public health issues, you know, that this pandemic's kind of exacerbated. You know, what can public health professionals do? What can, you know, what can we all do to kind of help bridge that divide?
Yeah, definitely. Had a conversation with my students yesterday in class, and I was mentioning to them that we're talking about healthcare management, healthcare delivery, and thinking about, okay, I use pre-COVID and post-COVID because post meaning right now, in terms of how delivery or healthcare was actually delivered, and for them to take a real look at it, because one thing we can say, and I do say that the infrastructure of our healthcare system is very fragmented, and meaning that because there's so many disparities that exist, health disparities that exist. So you now have, and that could be for a number of things. Health disparities exist, you know, but depending on age, sex, race, gender, it has many different avenues. So it's just not only just by race. However, when you see, for example, pre-COVID or pre the pandemic, how the delivery of care and the access of care, it was very fragmented. And now we're being pushed, or we had to be forced to be pushed to a way where we have to now include ways to deliver care that we used before. When I say we, I mean the U.S. healthcare system used before, but probably everyone didn't adopt it. Not every hospital or every clinic has EMRs, electronic medical records. So now, for example, people who are older, Dr. Franzetti said, his elderly population, they may not be able to sign up online or, know how to do things on, their phones or computers. They have to have their children or grandchildren to help them. So it pushes us to a point that we have to increase our health literacy. I think there's a major gap in between that and us as public health professionals. We need to do that not only in a classroom, not only in a healthcare facility as a hospital or a clinic, but find different ways and avenues to promote wellness and promote health and well-being. I think that we can't stay in a box. We stayed in a box. We have to think outside of a box, in a sense, because how we're delivering care, how we have to offer care is not the same. It no longer will be the same. So we have to find better ways to not only reach our underserved populations, but in our populations that we do serve, but also those who may be, for example, are in urban or rural populations who may not have the same resources or access to resources. We have to find better ways. It is not only one person's responsibility. It has to fall on all of us, because for me, when I came, and started to work in public health, I was always taught that we have to think about the well-being of the population, of the community, and we can't lose sight of that. So how are ways, we can't only think about billboards or pamphlets, or when they go to their PCP once, every 6 months or once a year. We have to find new ways and new avenues to reach the people and help them and assist them, through maybe having more, health educators or community health workers who are in the field actually working with the people to connect them to the proper resources that they actually need. So it's not a one-man job, but it's all of our responsibility.
And Dr. Sears, what are you hearing from students in your classes these days? Is it all talk about the pandemic and about vaccines all the time? Take the audience through kind of a class that's happening right now.
Right. So I teach at Manhattan College. I teach a number of public health courses. I am the public health program director. So we just launched our new public health program this past fall, which is absolutely exciting. So I'm very excited about that. But what I will say, in my intro to public health class, some of the students are tired of hearing about COVID. Some of them are, no offense. Some of them, I think that we see it so much on the internet and so much in the news and so much on our phones. They're like, okay, can we talk about another health topic besides COVID? But I have to also incorporate that, because you're seeing now, when you talk to the students, you're seeing that some of them, like a lot of students, are dealing or had deaths due to, had family members lose family members or lose people who they care for due to COVID complications. I am one of them. Or they had, for example, they had it themselves and they were freaking out, or they had a scare, now when they cough, they're like, oh my goodness, do I have COVID? And I'm like, no, relax. Like, so it's all of those things you want to address with them, because as a professor, our main goal is to educate the students, to provide information and knowledge to them, but also to learn from them too. So some things that they're experiencing, I may not know. So one things we're learning about in the classroom, that not all students want to talk about it, but some students who do want to talk about it want to hear from perspective as, okay, what is actually happening? Because a lot of them are experiencing burnout, in a sense. Some of them I have students who are, have to work full-time jobs plus go to school full-time because their parents lost their job. They're paying for their tuition by themselves. And they understand that, okay, it's a safe place, to talk about certain things and to hear about certain things. But also, most of my students are going to go into the health field. Most of them are public health majors, allied health majors. I have some psychology, radiation therapy majors, nuclear medicine majors. So all of them are going to go into some type of field of health anyway. And how they look and view health is we can't teach it the same way we did last year or 2 years ago. There has to be type of a change, and so I do implement that in my class, and they like it for the most part. Well, they seem to like it. I try to make little jokes for them so they can, break the air, a little bit, but they seem to like it. And we have discussions and real life discussions, and you allow them to think, because at some point in time they're going to go into the real world, and they're going to be experiencing things that when I graduated from college and undergrad, I did not experience. So preparing them, it's all about preparing them and also helping them grow. So to make a long story short.
Nate, you didn't graduate Manhattan, that long ago. It's three years this spring. I know you're a biology major, and you might have had an interest in research. What for you personally? What's the past year or so been like? Did you ever think? I mean, I don't think I can probably answer it for you. I don't think you'd ever think to be working in the middle of a pandemic, but
exactly.
What have you had a chance to kind of take a step back and look at the experience, at least over the past year or so?
Pete, let me tell you, I'm very thankful that I'm a professional and not a student right now. I couldn't imagine having to retain the kind of knowledge and information that I needed to as a biology major, not to mention the hands-on training that you need in the laboratories remotely, right? There's no way that I would have been able to graduate at the caliber that I was able to, or participate at, the internships that I was able to secure. And so I'm incredibly grateful for that fact, right? I just missed the pandemic barely. That said, I was able to get some meaningful experience under my belt as a professional post-grad. And this is not my first vaccine program that I've supported, right? So it's always been in the back of my mind that I'm doing a public service here, right? I'm making the world a healthier place in some respect, right? Just by supporting these programs, right? And I've had experience on the pneumo vaccine, the meningitis vaccines, the C. diff vaccines, so and more recently the RSV vaccines that we were working on before we had to transition to COVID. But to answer your question in short, no, absolutely not. I had no idea that something of this magnitude would come. And a good portion of that has to be dumb luck, right? There are plenty of pharmaceutical companies out here that I could be working for, or I could be in academia still, in a more research-based role. And I'm kind of in the sweet spot in terms of what research and industry, right? In terms of, right, I'm doing research for industry, which is a unique hybrid kind of role, and I'm tremendously thankful. But to answer your question, and no, I have not ever assumed that I'd be playing an integral role in solving the global health crisis, and truthfully, I hope it never happens again. Not because I'm afraid of the work, but just because of the implications, right? Like, how many people have to die for this to be front and center, and that's not something we ever look for. So yeah, it's been quite a ride, and I haven't had the time to really sit back. Right, we're still chugging away at this. Obviously, the vaccine has been approved for emergency usage, right? But we want that full approval, and we're seeking it. So there's still some work to be done to answer all of the questions that the FDA, CDC, and CBER have for us. So we're actively working on that. And hopefully, relatively soon, I'll be able to really put my feet up and look at what we've been able to accomplish in the last year, because it's no small feat. The amount of people, like just personal capital, people capital that we've had to invest, not a dollar amount, but the amount of scientists that needed to work together as a cohesive unit to make sure all of these things happened the right way, right? And on time, and make sure that we don't need to repeat it, and all of the above, right? So the scale of it isn't something that I've had time to really process, but we're here, and I'm thankful to be on this ride.
And Dr. Sears, what do you see, in kind of the short and maybe longer term from a public health perspective, and I was going back and looking at the interview we did last March, and I was kind of foolish enough to ask for a prediction then, when there was a lot more gray area. So I don't want to ask for a prediction now, because even though things do seem to be trending in a better direction, a lot of people have said, we've underestimated this virus before. But where do you see things? Where do you see kind of the future of public health in the next 3 to 12 months or so?
Oh, that's shorter than last year. You said it the next year, but it's okay. But definitely, I think that as time goes on, we're going to see more rollouts of different vaccines. So in the accessibility of vaccines, the just because there's accessibility to it, again, I'm hesitant to say that, especially when it comes in particular communities, the uptake of it. And for me, it's all about education, educating, advocating for yourself. So I think over the next, 3 months to even a year, I believe that more people will take the vaccine. I believe people will be more educated about the vaccine. That's my hope. But people actually, my general hope is people actually taking the time to actually be an advocate for their health, and actually being able to educate themselves on the pros and the cons of anything, not just the vaccine, but just anything, and thinking about, okay, what is it that they need, or what they desire, what they want. So for example, I tell my students this: when you're going to your doctor, you don't only go there to talk to your doctor asks you questions. You go there with your questions. Dr. Franzetti, I hope your patients do this, that they come and they ask questions, and they're able to receive real answers and from their physicians and their primary care physicians, or any type of physician that they are interacting with. And I believe that we have to stay strong in that, and we have to grow in that we have to be advocates for our own health. I tell my students that if you don't advocate for your health, you can't expect anyone else to do that. So in the next 3 to 12 months, I believe that we're going to see, of course, increase in people who get the vaccine, accessibility for the vaccine, but also my hope is the education increasing, the awareness increasing, because with the lack of knowledge, we won't know. And I think we have to actually go out to get the knowledge. So I know I read an article, I believe it was this morning, that was saying, especially in communities that were in Black and brown communities, where the uptake of the vaccine, the hesitation of the vaccine is very, very high. And that has to do with history. What happened with the Tuskegee syphilis experiment, Henrietta Lacks, etc. People are, very mistrustful of the healthcare and the government from those particular communities. However, one thing that we tend to do in the field of public health is have community leaders, those who are very popular, those who are known in the community, for them to be on board with certain things and certain things we want to implement in communities. Therefore, and also education, so now it can increase them to actually get the vaccine. So, for example, I'll give you a quick example. If you were to have maybe the person, when I was growing up, we had the crossing guard. She knew all our business. She she watched out for us. My mom would make sure, that the crossing guard knew our names, because she looked out for us. It was this community aspect. And so, for example, having that crossing guard, for example, who knows everyone's name, who knows all the parents, and she's the one talking about the vaccine and advocating for the vaccine, it is very likely now that those families will say, you know what, because that crossing guard took the vaccine and she's advocating for it, that means that I can trust it. There's I have some type of faith in that I can trust that, but the vaccine won't cause me harm or detriment, but it's for my good. So, using people within the community to actually talk about the vaccine and, educating more people about it, I think that's what we should strive for over the next couple of months, because if people do not know, or people are being misled about the information they receive, because not all information on the internet is gold. I tell my students, please don't cite anything with Wikipedia, because I'm going to give an X, a big X on your assignment, because Wikipedia is not a credible source. You have to use credible sources. So know where you get your information from, and also seeking more than one credible resource for information. So talking to your physician, but also know you can get a second opinion as well. You don't have to only rely on your particular physician, but also you can get another physician's advice as well, and then make your decisions from there. So that's my hope over the next 12 months, 3 to 12 months.
That was a bit of an odd time frame. I apologize for that, but
it's okay.
Dr. Franzetti, you mentioned before, one, I think, key takeaway, from the clinical trials that we've seen is that, the vaccines that have been approved so far, and the Johnson & Johnson one, which ironically could be approved today, we haven't seen any deaths or even any severe illnesses, I believe. What beyond that, what are you trying to take away from the last couple months? How are you trying to educate your patients, and kind of what do you see, going forward over the next couple months?
Well, just one correction. When you look at the vaccines, there have been 64 million in this country given. There have been 13 deaths, but they haven't tied them to the vaccine. So one of the things I like to be is very honest, because people are going to find that information on the internet. And unfortunately, yes, Wikipedia is going to list, possible death. But it's nice to put it in perspective where it's, 13 out of 64 million, odds are you're safe. But Dr. Sears had it right, and I agree. I always feel when I come to the college, I'm the second opinion. They already did their research, they have their questions, and I think it's great. WebMD is one of those things that, it's always a scratch on your hand to, make sure it's not cancer, but the students do that research and they are asking questions. So I think your point is well taken and your students are listening to you. As far as in the next few months, I think that the availability of the vaccines, and the more people get it, the more they're going to go tell their friends and neighbors that they took it. They're going to see that they didn't have any ill effect from it, and they're going to start coming in and requesting it. As they roll out more and more vaccines, regardless of the manufacturer, especially since Pfizer might be able to just be a regular freezer now and not the deep freeze, you're going to see it in the hands of more of the pharmacies and physicians' offices, which then gets to that herd immunity at a much quicker pace. So as they open up more of the medical conditions that can get the vaccine, you're going to see more and more people get it. And then hopefully, I know they talk by, I believe President Biden said by maybe December, it'll be a little more normal. And they were talking maybe the end of the summer. The way we're going, if we can maintain the number of vaccines we're given, it'll be more towards the beginning to the middle of summer where we could get that herd immunity because of the amount of people taking the vaccine. The biggest issue, again, it comes down to education. And like Dr. Sears said, yeah, there are certain populations that are very reluctant to take the vaccine, and that's the ones that we really have to make an effort to reach out to.
Totally agree. And we're a little bit past our time here, but I wanted to wrap the discussion by thanking all of our panelists. Nate Garcia, Dr. Carl Franzetti, and Dr. Tekeyah Sears. Thank you all for your time, for your wisdom, for your insight. Really appreciate each of your perspectives, and really, on behalf of all of us at Manhattan College, really appreciate the work that each of you are doing in your respective fields to, just make what's a scary situation, a little bit better for everybody as we go forward. So, thanks everybody. Thanks to everybody who joined us online, and have a great weekend.
Well, thank you.
Thank you.
Thank you.
Be safe, everybody.
Bye.
Bye-bye.